Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Oh, yay, it connected. Always a bonus. Oh, we've got the Philippines in the house. Very cool. Dan was smart, he brought his coffee. I get it at some point.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Good morning, everyone. TGIF. I don't know why I should care. I'm retired. Every day is a weekend or every day is a work day. I'm not sure which. I am so excited for today's little morning chat with you guys. This is a topic that we have been talking about kind of off and on, and we are going to continue this conversation with a pretty strong impact because I think this is so important. So what we're talking about is the use and misuse of antibiotics in both the veterinary and human medical field. Maybe we're going to have to find an MD to have this discussion with us as well. But my guest this morning is Dr. Dan Taylor. He is a veterinarian with a PhD in epidemiology. He's a really smart guy from the Colorado School of Public Health. He received his veterinary degree in 2010. Oh, he's so young, from Iowa State University, and his master's in public health from the University of Iowa in 2010. Dan's main interests areas of interest are antimicrobial resistance, and we've been talking about that. Food safety, huge, infectious disease, and veterinary epidemiology. Dan, thanks so much for agreeing to chat with us this morning.
Yeah, thanks so much for the invitation. And this is certainly a very important topic of antibiotic use in veterinary medicine, and it's certainly something that seems to be gathering a lot of attention. And really happy to be here today with you and your viewers to talk about this a bit.
Thanks. And for those of you who have been following us for a while, you know that we do occasional summits, and we do have a summit coming up in September that it will be a cat summit. And then in November, we'll do our usual November summit, and Dan has agreed to come back and do a longer conversation with us at that time. And I think that he will have some more information that he can reveal at that point. But Dan, can you give us an overview of your research on antibiotic use? I know you have a published paper on use in livestock, which is certainly important for our food chain. And then I believe you have another one that's going to be released soon on small animal antimicrobial use.
Yeah, so we've done quite a bit of work through my PhD work. I just completed a PhD last fall in 2020 after being in practice for about a decade. And a lot of that work focused on antimicrobial use, not only in production animals, but also our companion animal friends as well. A lot of that research looked at the how and the why of why antimicrobials are prescribed to animals. A lot of that social or behavioral type of aspect. So at the Colorado School of Public Health, through my dissertation, we looked at use recommendations through veterinarians. In particular, the publication that you mentioned, Dr. Morgan, which is in review currently, was a study that looked at the prescribing recommendations from over 2,500 veterinarians throughout the country. And in this assessment, we presented hypothetical clinical scenarios that were very common to the practitioner. The cat with a runny nose that just came from a shelter, acute diarrhea, in a dog that's otherwise healthy, lower urinary tract signs in a cat, those really common clinical scenarios. And we asked recommendations from veterinarians based off of those scenarios. And what we found was not super surprising, in that antimicrobials or antibiotics, those words are used interchangeably. But what we found is those medications were used quite a lot in situations that were not warranted. Now, this study did not measure actual prescription practices, but looked at what a veterinarian would hypothetically recommend given that scenario. Some other things that we've looked at over the past few years are also pet parent perceptions and attitudes surrounding antibiotic use in dogs and cats. And ultimately with that study, not to go into too much detail and give away too much of the story, but ultimately what we found was that pet parents ultimately want what's best for their pet. They also want to be part of that decision-making process with the veterinarian. They trust their veterinarian and trust that education and that advice that their veterinarian provides. So ultimately, it's not that a pet parent comes in there wanting an antibiotic all of the time. They just want to be part of the process and be educated and be allowed to trust their veterinarian with that final decision of whether or not to prescribe an antibiotic.
I think that's an interesting point,
Mm-hmm.
because I think that pet parents are becoming much more educated about their pet's care, and they do want to have a say. And unfortunately, with COVID and curbside, we have seen a lot of unilateral decision making where the pet gets treated and then gets delivered back to the car with all the treatments performed or prescribed, and the pet owner was not even aware. So that's added just another layer of frustration.
COVID did not do our profession any favors in terms of the communication aspect. So yes, you're absolutely right that pet parents are now wanting to be more educated and more part of the process. And I think something that we're all seeing in practice a little bit here is when veterinarians do recommend an antimicrobial drug without explanation, pet parents question that and want to know why. It's not a question of a veterinarian's judgment. It's more of a question of just why. And that's something that is on us as veterinarians to explain.
Exactly. So I cut you off. You were going to give a third layer to that pet parent.
Yeah, and I think this third study that we've just completed over the last 6 months or so that really underscores the importance of the team approach to the decision of whether or not to prescribe an antibiotic is we looked at veterinary support staff and their attitudes and perceptions and their involvement in the antimicrobial decision-making process. So technicians, client care specialists, veterinary assistants, they're vital in that decision-making process. So we take not only the veterinarian, and at the end of the day, it's the veterinarian's license and legal authority to prescribe that medication. But we also looked at the pet parent and the support staff to look at it as a stakeholder, three-pronged team approach to the use of these drugs. And I think ultimately, if we are to improve use of antibiotics in animals, it needs to come from that stakeholder approach.
Did you find any different attitudes with the support staff than you did with the veterinary staff?
Everybody thinks it's a problem, but nobody thinks it's their problem, I think is the easiest way to sum that up. Okay. And that is prevalent through the human literature as well. It's a problem, but it's not in my hospital. It's a problem, but it's not at my clinic. It's a problem, but it's not because of my prescription practices.
Very interesting. Well, no one wants to accept responsibility.
Sure.
So do you think that the data that you found, does that support the misuse and the overuse of antibiotics? I mean, I certainly think that there is a lot of that going on. Do you feel like your data in both the livestock and the small animal realm both support that?
Well, that's a really great question, and I think to answer that question, it's my opinion anyway that looking at production animal medicine and human animal medicine, or I'm sorry, companion animal medicine, needs to be done through a different lens. They're just so different. Production animal medicine is usually done on a herd or population basis. There are a lot more legal authorities now in terms of prescribing antimicrobial drugs to production animal species like cows or pigs. So it's becoming more regulated, and there's more of a regulatory basis for that. So in that sense, I think that there's been a lot of effort to curb misuse or overuse of antimicrobial drugs in production animal medicine. And it's taken the effort of a lot of researchers and government agencies and veterinarians to come up together and get behind the effort. So I think a lot of actually great work has been done there. When we look at companion animal medicine, on the other hand, I do think that our studies have pointed to evidence that there may be overuse or misuse of antimicrobial drugs on a really more prevalent than we like to accept basis.
Yeah.
So again, our study didn't measure actual prescribing, and there's some really great efforts through the University of Minnesota, for example. The FDA has really gotten on board with use in companion animal medicine to really pin down the use and to give us a better idea of whether or not these drugs are being overused.
Exactly. So, for our companion animals, this overuse of antibiotics, what kind of effects do we expect long term with this? What's the problem with it? I mean, why should we care?
Yeah, that's a really great question. What's the problem? If let's take the example of a young, healthy dog who was just in a boarding facility while their pet parents went on vacation, and that comes home with a cough. And so the dog goes to the veterinarian and is diagnosed with kennel cough. So the veterinarian has a choice to make. The veterinarian can say, all right, I'm going to prescribe an antibiotic for the cough, or I'm not, one of those decisions. And so we look at the short-term implications of that decision. And if an antibiotic is prescribed and the cause is truly not bacterial, it's viral, which we all know with COVID now, viruses are not treated with antibiotics, then that dog just received that drug unnecessarily.
Right.
And we might ask ourselves, well, what's the problem with that in the short term? And the big issue with that is it can really alter what's called the microbiome in the pet's intestines, in the skin. Bacteria obviously are naturally present in animals, and they perform really important and sometimes unknown functions within the animal. So we can alter that for a time in the short term, and that can recover. That can go back to normal. But I think in the long term, it's really an invisible effect. We don't see that, maybe even in our career. We don't see the implications of that. And I think the best way to put the long-term effects is that with every antibiotic prescription that is made, whether it be human, whether it be production animal, whether it be companion animal, and whether or not that prescription is appropriate or not appropriate, that puts pressure on bacteria to change and to become resistant to that. So I think the big concern long-term, Dr. Morgan, is that we run into a situation where antibiotics just aren't effective anymore. And we look at what happened before the 1940s, before penicillin was created, and what would happen with really simple bacterial infections. People would not do well with those. So I think that's the big concern long term, is that overuse and misuse in veterinary medicine is contributing to that as a public health issue.
Right. Yeah. The antibiotic resistance is just becoming bigger and bigger and bigger. We're dealing with a case of that at our farm right now, where the donkeys came with an upper respiratory infection, responded really, I mean, it was bacterial. They had thick yellow snot coming out the nose. So they were given an antibiotic injection. It worked great. And everything seemed fine. 2 months later, we've got something that's blown up and it is not responding at all to that antibiotic. So, or it didn't respond at all in round 2. So now we are at the point of we have to do cultures, and we're actually doing viral PCRs as well, because I think that we have multiple bacteria. I think we have multiple viral infection. I think this is just a huge conglomeration that jumped in, but that antibiotic resistance certainly is not helping our situation. Now, you know, this is kind of one of those decision-making processes. We had a 2-month-old donkey with pneumonia. He needed an antibiotic on day 1. You unfortunately, but what I wish we had done, we did a PCR for strangles, but I wish we had done a deep culture at the beginning and known exactly what we had. At that point, it did respond to that antibiotic, so it might not have been so helpful now, but maybe we'd have a little bit better idea which direction we were going. And so this is the kind of thing that happens. And unfortunately, I see in our small animals, every time somebody blows a little bit of diarrhea, metronidazole is flying off the shelves. First of all, metronidazole is not without side effects, not even talking about antimicrobial resistance. It can cause neurologic problems. It can cause bone marrow suppression. I've had dogs get aplastic anemia from it. People don't, first of all, people aren't informed by the veterinarian. These are the possible side effects. I wish that veterinary medicine was like human medicine, in that you were given that sheet of paper that said, these are the potential side effects. Please watch for these side effects. And then all of that was explained to the pet parent so that they would understand that maybe a change in their pet that they're seeing is actually a side effect, instead of just going, well, he's sick, so I guess this is part of his illness. So that, and we need better options. So what impact, because, and I know that in the past few years, FDA and CVM, which are regulatory agencies, changed antibiotic use in livestock because of this resistance to the antimicrobials. And farmers really have to have that relationship with a veterinarian to prescribe the antibiotics for the food animals. So this is kind of a multi-pronged question. In your eyes, has that decreased and kind of put a little bit of a checkmate on some of that overuse in the livestock? Second, if antibiotics are used, are they being used herd-wise, or are they being using more for individual animal? If it's used in that individual animal, I know we have withdrawal times before the meat and the milk can be used. So do you think it's made a change?
I do. And I think there's data that's starting to come out to say that antimicrobial use is reducing in production animal medicine. And a little background for your viewers here this morning. Antibiotics are used in livestock traditionally for 4 main purposes. We've got our treatment of an individual sick animal. So that's that single cow that maybe has pneumonia. Antibiotics are used for what's called a metaphylaxis purpose, which is where within that herd, within that population, maybe a handful of animals are sick, but the whole herd receives those antibiotics to prevent the illness from spreading. We have a third use called prophylaxis, which is antimicrobial use around a stressful event. So let's say that animals are being moved from one facility to another on a truck. That's stressful for an animal, which can lead to illness. And then the fourth purpose is growth promotion. Now, growth promotion use of antibiotics is no longer allowed in the US. So I think that point right there shows that use is way down over the last 5 to 10 years from that use right there. I think traditionally, these animals are treated on a herd basis, and it all depends too on the operation and the facility. It's really hard to individually treat a few animals when the herd is 5,000 animals large. But at that same time, if you've got 4 cows in your acreage, those are easier to treat on an individual basis. So I think it's really highly dependent on the setting for these animals. So yes, I do think it's decreased. Yep.
So if a herd was, like you said, undergoing a stressful event, being moved, so we're moving 1,000 cattle, and so the whole herd is put on antibiotics, that would mean that then that whole herd has to be held for whatever the withdrawal period is, correct?
Yeah, and typically those drugs that are fed, because when we medicate an entire herd, it's usually through the feed or through the water. Because you can imagine giving the individual animals it would take forever. And typically those antibiotics are given at a point in the production stage where the withdrawal time is more than met. And typically those withdrawal times are not as long as some other drugs. And I think it's important to point out here too that even if animals are treated with antibiotics, before they hit the grocery store shelves or before processing in that aspect, there's no antibiotic in that animal. So just because the cows were treated with an antibiotics at some point in their life, it's not going to end up in your hamburger. The US has one of the strictest antibiotic residue programs in the world. The consequences to a producer for finding antibiotic residue in meat is very high. So that's avoided at all costs.
Do those same standards hold for imported meat? Does anybody test that imported meat that comes in?
They do. That's very highly regulated as well by the Food Safety Inspection Service, which regulates both domestic and international import of meat.
Okay. And then my next question is, so the meat is withheld from going to market, and the milk has to be disposed of if it's a dairy cow that's being treated with antibiotics. Where does that meat and milk go? Like, how do they dispose of that? Because if the milk is dumped into a waterway, wouldn't that, now that antibiotic is now in the waterway, would that have effects for us? Where does this go? Where does that meat go? Where does that milk go?
You bring up a very, very good point. And, certainly that meat is disposed of, usually rendering, or, a lot of times the animal's just held and processed at a later date for that withdrawal time to pass. But the milk, I think, is more of an issue, because that can't just be held. They have to do something with that milk. And I think that points to a broader issue, and that's the environmental role within antibiotic resistance, because whether antibiotics are disposed of in milk, disposed of in manure or urine from animals, or waste from humans, that's all going into the environment. And that's really, I think, one of the personal opinion, the more neglected aspects of targeting antimicrobial resistance is not taking into account the environment. You look at some environmental studies. I would not be able to cite this off the top of my head, but there was a study out of Seattle a few years ago that looked at the water in the Puget Sound, and just all of the medications that were found, not only antimicrobial drugs, narcotics, antidepressants, all that stuff ends up in the environment, in the water. which
there's been
can,
good studies in Europe showing the flea and tick pesticides are just in high levels in the water. Very
yes.
scary.
Yes, definitely. So yeah, that environmental aspect, I think, is something that people don't recognize right off the bat.
Yep. Dan, I could talk to you about this all day, but I've already used up a half hour of your time, and we are so appreciative that you were willing to come on, and we are going to have you back in November. We'll dive a little deeper, and then I think your small animal paper should be published by then.
Fingers crossed. It's
Yeah.
still in review.
We know
right
how
now.
long these things take. It's getting something published is a giant hurdle. And I was on a team trying to get a paper published on the side effects and dangers of the isoxazoline flea and tick chemicals, and it took us a couple of years of a lot of work and persistence. So I understand that, and that's why I'm not a researcher, I'm not a publisher, because I don't have that kind of patience. But we really appreciate the work that you're doing, and we're going to continue the conversation. Like I said, I wrote a blog on this that we will release next week. We'll try to put links to your paper that is published, the large animal paper. And when the small animal one comes out, we will certainly link to that as well, because this is an important conversation that needs to continue. And for those who are watching, I think you need to really keep this in the front of your mind when you take your pet to the veterinarian, when you take your child to the pediatrician, when you go to the doctor. Really consider, do I really need an antibiotic? I mean, we just went through about 4 different viruses, human-wise, thanks to daycare, with the parents and grandparents in our family. And some ended up on antibiotics and clearly needed them. I managed to fight off the viruses and didn't get the secondary viral infections. Yay, immune system. But we try hard to be vigilant about what we are putting in and on our bodies and our pets' bodies. So Dan, thank you so much. I can't wait to continue this conversation.
Very much appreciate the invitation to be here, and look forward to discussing the issue more with you and your viewers.
Thank you. I can't thank you enough, really.
Welcome.
We're getting the welcome. Yeah. It's supposed to be the bye-bye. Everybody, we're going to continue this conversation. You can put in the comments how your animals have been treated, how you're being vigilant, how you're being the guardian of antibiotic use for your own pets and yourselves, because it is very, very important. Again, Dan, thank you so much. We'll talk to you again in November.
All right. Take care. Bye, everybody.
Have a great day.